Welcome to Home Care, Doors Open, where we discuss licensing, operations, and scaling your home care business. Whether you're just opening your doors or looking to unlock new doors to growth and success, this podcast is for you. Let's begin.
Okay, hello everybody, and welcome to another episode of Home Care Doors Open. I'm super excited for today. My name is Lucas Carroll, the host and CEO of the Business of Senior Care. And today we have a guest, Barb Provini, who is Associate Clinical Director with ACHC. Barb, welcome.
Thank you. Thank you. I'm looking forward to seeing what you're all about and sharing some things about myself and ACHC. So.
Absolutely, yeah. I'm excited to jump in, and I think, as we'll explore here, our audience will be interested to learn about your knowledge and expertise and your
Okay.
your years of background and experience in the home care and home-based care setting, and then your journey to ACHC. But maybe just start with telling us kind of what's your current role that you're doing with ACHC? What is ACHC, and what are some of your previous experiences that led to that?
Okay. Sure. ACHC is the Accreditation Commission for Healthcare. We're based out of Cary, North Carolina. I work remote. Most of our employees probably work remote because they're surveying or they're supporting in some way. And we started out as home health and home care in North Carolina and grew into hospice. And we have DME and we have pharmacy, sleep labs, and about almost 2 years ago, or maybe almost exactly 2 years ago, we added a hospital side to our accreditation offerings. So we really offer kind of soup to nuts now as far as what healthcare is. We do assisted living, we do renal dialysis, so behavioral health. We have a wide variety. I became involved with ACHC 14 years ago. I was living in Pennsylvania previously, and I had some various experiences. IT was one of them for a short period of time, but it was supporting a clinical platform. But then most recently that got me here is I worked as the quality manager for a hospice. It was a hospital-based system. We had home health and hospice, but I was only working with the hospice at the time. And I was moving south. And so ACHC was our accrediting organization, and we always enjoyed the way they interacted with our staff and how they presented and completed the surveys. So I sent a resume in, and I got hired initially as a contract surveyor for hospice. And hospice was one of their newer programs, probably a couple years by then. But I was contract for about a year and a half, and I did want to go full time. They were really nervous about making me full time at first because they wanted to make sure they could keep me full time. And shortly after I went full time, we hired another full time person who's still with us, and we've just expanded quite a bit since then. So I surveyed for about 3.5 years, and then I came inside, more or less, what we call it, and I became a clinical review specialist. And so my job was to process the surveys that came in, and we had a very small team at that time. And we just reviewed the surveys, made sure that things were cited in the correct place, made survey decisions, did the plan of correction, approved the plan of correction if there was any evidence needed. We did that kind of stuff, did the reg packets that got then sent out to CMS at the end or to the state, depending what the program was. And then in 2020, I became the program lead. Program manager was the title at the time for our home care, and we were just starting our palliative care program then. And I now have 6 people that work on the review committee with me, and so I supervise them, and we process about, on an average, maybe 60 to 80 surveys a week.
Wow.
We're real busy. I think one of the things, I was just saying this to somebody else, one of the things that made us so much busier was when, I can't remember what the legislation was called, but it was requiring home health and hospices to be surveyed every 3 years. And a lot of them were way behind because the states were way behind. And that really helped boost, what we were doing. And home care has just continued to grow since I've been, part of that program. And that's been interesting to learn all the different states and what they require.
Absolutely.
So that's how I got here. And I've learned
Awesome.
some things about behavioral health and other home infusion therapy along the way because they were added programs for us
Yeah.
since I started.
Right. You've seen some big growth for the
Hmm.
organization and for yourself. In the home, I'm thinking of like we have a lot of our clients, the majority of our clients come in this private duty or non-medical home care space, which that's one of your fortes in your current role. Is that right? The
Right.
non-medical.
We went with home care, kind of with Home Care Association of America pushing that instead of calling private duty, but private duty is a common term. I mean, it goes back and forth
Sure.
either way, and a lot of times nursing it gets entered that way, private duty nursing. So
Yeah.
yeah, so I've been involved with that program for 6, 7 years now.
Okay. And for I'm trying to think of, folks that may tune in our audience are individuals that are in the process of starting a home care. It could be home health and hospice, but most of our clients are non-medical home care, either with a franchise-based system or an individual in their town, and they're thinking about jumping into the home care space to help take care of our seniors.
Hmm.
What are some things that you would say to them in terms of when it comes to the accreditation component to be thinking about, to consider, to kind of understand when it comes to the non-medical home care accreditation?
That's a good question, and we get that a lot. Why should we become accredited? And I think um, the biggest thing that you kind of have to go through it before you really feel it is that you're really showing that you're interested in providing quality care and doing the right thing. And some states have a requirement for it, and that pushes it in that direction. But a lot of states don't, and people still are interested in doing that. So what we provide to you is education on how to meet your regulations. What does your state mean when they say these things? We're very educational in the way we do our survey, but also how we work with our customers throughout the accreditation process. We have a means of people asking questions via their accrediting account advisor,
Yeah.
and we also talk to customers that are like, I'm renewing in a year, and I've had this happen. So what should I do about it? Or even before they do it. So we're a partner with them. We help them uh, get try to help them at least get them where they want to go. We look for their goals. We have to be careful because we're not consultants and we can't consult, but we can educate on the regulations and on our standards. Going through the process, we have a whole quality part that you're a new startup doesn't necessarily have a lot to do with those things, but it's kind of getting an agency to be looking at their records and looking at their personnel records and just the care that they're providing to make sure that they're meeting the regs every day and that their staff understands what they need to do and that there's a plan of care for that client and that what the aide or companion or even LPN or nurse are doing, that they're following that plan of care, and what to do if you're not. Like, re-educating might be the key, or you know, implementing an electronic health record might be the key to consistency for people. And in the beginning, it's only a few people usually, but then as they grow, they add more people, which tends to sometimes lead to more people who can make errors for you. So,
Yeah.
you got to really be on top of that documentation and follow through and making sure the client's getting what they need.
Absolutely. That's such good insight. What it makes me think when you were saying that is that, like, we focus a lot, we help clients with licensure in their state, but there are a lot of states that don't, not a lot, but there is a handful of states that don't require home care licensure.
Hmm.
And for ACHE, what it makes me think is, like, it just kind of, it creates a quality playing field if your state doesn't require licensure. And even with some states, they do have licensure, but the licensure threshold or the procedure or maybe the regulations aren't quite extensive. So there are varying requirements when it comes depending on the state, but kind of the ACHC will, regardless of the state, it seems like you kind of create a quality threshold because the standards would apply wherever you are.
Right. That's exactly right. Because our standards are what they are. When we go in to survey an agency, we do have the state regulations embedded in the tool that the surveyor is looking at so that they can ensure those things. But, there's lots of stuff that we require, like annual education, and we specify what topics, and we specify that for non-direct care, they have to provide 8 hours of education, but for direct care, they should provide 12 hours of education. And they can really pick what those 12 hours are, except that we say, you should be reviewing your infection control every year. You should be reviewing how does a client, what is a grievance? How do they file a grievance? What do I do with a grievance when I get it as a staff member? And what's the agency responsible for following up on? I said infection control, list policies and procedures, when emergency preparedness, the quality program, we just, and tell your staff what you're working on, tell your staff how can they participate, that we look at what you're doing and we want to give you props for the great things you're doing. So, we're doing QAPI. Then I think can't remember how many topics that are off the top of my head, but there is room for for an agency to say, hey, we're going to start taking peds, so we're going to add education on pediatrics or something like that. So it doesn't, at that point it's up to the agency to look at their organization and go, what do we need education wise, or is there a new pump out there for something that we're doing, or a new transfer technique, or whatever that might be helping based on what kind of clients the agency cares for.
This episode is powered by the Business of Senior Care. The Business of Senior Care helps home care, home health, and hospice companies obtain their state home care license and accreditation through one-on-one consulting, fully customized policies, and years of expertise. To learn more, visit thebizofseniorcare.com. And now, back to our episode.
Yeah, so many questions I want to ask you. I was going to ask, that one just escaped me, but the states, just as you were saying that, for your standards and then for also like the state regulations, what does that relationship look like with there are new regulations that come out, or maybe existing regulations, and you're trying to interpret that? Does ACHC try and develop a relationship with the state to say, hey, help us understand what the guidance is for this regulation so that we can help to guide our agencies?
We absolutely do that. We have a regulatory department, and that is their regulatory and quality department, and that's their job to when we have a question on what exactly are you looking for here. Or sometimes an agency says, no, you're wrong. We don't have to do that. And we will go, sometimes during survey, we're able to reach out, and we don't always get an answer that day, but if we don't, we'll, get back to them to say, well, and I'm going to tell you, sometimes they're right, but because we've interpreted a certain way, but, usually we can come back with them and say, we spoke to this person at the state level, and this is what you are required to do. And, they'll, at that point in time, they go, okay, we should, and anytime we have a question, we prefer to provide an answer to the agency in writing, like, so this is where we found it. It was on this website, or this is who we spoke to, that kind of thing, so that they can refer back to that too.
Okay, that's
and
good.
I don't know if you were leaning towards this at all. I kind of thought you were when you started to ask that question, but if there's something overlapping, the agency is responsible for doing the most stringent. So if the state is more stringent on an educational opportunity or a criminal background check, or some education that needs to be provided annually, that's what we expect the agency to do. If it is a home health or hospice, whether it's the state or ACHC or CMS, that is most stringent. That's what we expect the agency to follow if they're going to be our customer and be accredited by
Got it.
us.
Got it. I was remembering what I was going to ask you, the checklist. So we've worked with a number of home care, home health agencies that utilize ACHC, and one of the things that I always enjoy is that the checklist for survey preparation, the checklist for interpreting the standards, like it's always very clear. Like it's not a mystery. I mean, it's like these are all the things that you need to make sure that you have prepared in the personnel file. This is what you need to have in the
Hmm.
client or patient file. This is what you need to have. These are the policies that we'll be looking for. They need to follow these standards. I, I always enjoy that it's just there, and then when the individual comes out to do it, that's what they're looking for.
Right.
Sometimes, I've been a part of when maybe the state health department comes out, and then you don't. Sometimes it's not exactly what they're looking for, and you don't know, and sometimes it's a mystery. So I really enjoy that because one, it helps the agency to be in compliance and make sure they're doing the right thing, and they're preparing um, for the survey by being in compliance. And then two, you guys come out and then you look at the items that you say you're going to look at, which I think just really I've always enjoyed that in our
Hmm.
agencies have when they've worked with ACHC.
Hmm. Yeah, yeah, we try really hard with that, and that's something that our educators for our surveyors work really hard at because sometimes people come to survey and their agency always did it a certain way, so they think that that was correct. But we have to sometimes break that out to go, well, you might have gone above and beyond, so this is what the reg says, and
Mm.
this is what the state of California requires. We that's why again we try to show it to them in the regulations, so that we're not leaving them guessing. And sometimes people, we've had people challenge us on whether we're interpreting it correctly. And like I said earlier, that's when we go back to the state and say, just to make sure that this is the way we understand it, is that correct? And then we can, give that feedback or have that discussion. We really feel that it's a collegial um, interaction when we're on survey. We expect, we want it to be educational. Um, that's what we're there for, to be educational on the regulations. What can you do? What would help you meet this in the future?
Yeah.
What you might need to do, that kind of thing. So,
The survey part, I'm just so curious now. Like, give us some scope of you guys are out there, you have team members out there performing surveys everywhere. Like,
mhm.
how many surveys do you guys get done, like in a year, or all the
I don't know.
places that you go, or I'm just
We're
trying to
we're
get,
in every state.
yeah,
We every once in a while we have a couple of people who buy because they know that there's something come up in Hawaii and they want to go there. We
sure,
do
sure,
some surveys in Guam and Puerto Rico. Um, we actually have a branch of our agency that does some things in the UAE. That it's very much like a home care environment because they don't have the CMS regulations there. So the
okay,
survey is similar to that. But yeah, we are out there. Like I said, we probably have some 80 surveys in a week. That may not be every single week, but you're probably, you multiply that times, at least 40 weeks a year or something like that. That
yeah,
I don't know the actual numbers of how many surveys we do. And that's only the community based. We still have people who are doing pharmacy and DME and sleep lab. And, so for having one office well, we technically two offices in Cary, um, all of our surveyors are remote and we just go from wherever we are. When I first started, everybody had to, and California started becoming busy. And we had all the people from the East Coast going over to California, which can get expensive. I mean, but now we have
yeah,
surveyors in many, many states, and they go wherever we need to do a survey. And our most of our surveyors are full time, so
okay.
we have a couple contract that can say, no, I'm only going to stay on the East Coast. But as far as surveying for full time, um, we we try to meet their requests, but we have to also meet our customers' needs and demand. So, but yeah, we're busy.
Yeah, yeah, that's an
Hmm.
understatement for sure. For home care agencies, home health and hospice too. Like, what do you guys in terms of what are usually the approach for getting to know your standards, getting to know the regulations? There's a thousand, for somebody who's looking to start up an agency, they're doing a thousand things, and compliance is one of them, and it's really
Hmm.
critical. What sort of guidance or suggestions do you usually have in terms of getting familiar with the standards and regulations to operate your agency?
Well, I mean, the standards, they should download those when they decide that they're going to move forward with us. They can ask questions as they go along. We've had some customers who want to go through each section of it with us, and sometimes we're able to do that. But we have a couple different ways. We have a guide to success workbook that
Hmm.
people can purchase, and and we also do a workshop around that, and the workshop is about going through the Guide to Success workbook. But it has in it every standard and what meets the standard and where the surveyor will be looking for um, evidence to support it, because sometimes it's a policy, sometimes it's an observation, and that means, we can see in your office space that, equipment is maintained and, where staff works, or sometimes it's personnel records, sometimes obviously it's patient record information, interviews, we talk to staff. So this guide to success has like kind of even what we would ask, your director of nursing, what we might ask your nurse. And what we try to connect when we're on survey is this is your policy and this is what is being done in real life, and does it match? And which is one of the reasons we interview staff so that we know if they know what they're supposed to do or where they can find it out if they don't know off the top of their head. You know, we try to, like, I might ask an aide questions, but I'm asking about the care they provide. I'm not, I might say, do you have any quality programs that you're involved in or anything? And a lot of times people don't necessarily know that if they're not directly involved. But I can say, what do you do if, your patient doesn't have a do not resuscitate order and they stop breathing in front of you? What are you supposed to do? And,
Hmm.
many agencies, they're supposed to call 911. Many agencies have their staff CPR certified and they're supposed to start CPR. But the other pieces to that is that the client and the family is told that's what this person will do if this happens. We don't really require you to provide CPR. Some agencies will say, have in their literature that we don't do CPR. If somebody passes, we will call 911 and we will be there to support, kind of thing. So we're just looking for, from policy to application, that people know what they're supposed to do and then they're following that. So that's kind of something we do with all those interview questions and asking about, some policies and things like that during the survey.
Absolutely. Absolutely. Good, good. Well, the final, I just had one final question kind of about the future for you. I mean, I've enjoyed this very much, and I appreciate the insight that you've given to myself and then all to our audience too. Looking forward, as you look into 2025, what do you see in the home care space in terms of accreditation? Things, maybe legislation coming down, big regulation changes, expansion of accreditation. Like, what are you seeing some things into next year?
I see a lot of talk at the legislative level about, the push for Medicare to cover home care,
Mm,
versus, because there's not enough facilities out there nowadays. And, going through the COVID experience, people don't want to necessarily, put their loved ones into a facility that increases their risk right now. So I don't think that legislation sometimes moves as fast as we would like it to be, but I would love to see that happen. That, if you can pay for a skilled nursing facility for a patient, why can't you pay for home care also? And there was just something passed just this week about VAs being able to stay at home and not VAs, veterans being able to stay at home and get some resources paid for by the VA. And so those are all like good things. And I think that there's a lot of people who are pushing for more care for people who need it as they're getting older,
I
and
agree.
support for families in the home, you know.
I agree. I think the momentum continues to be towards home-based care, and I'm here for it. I'm excited for it, and I know you
Absolutely.
are too, because I think that's the best place for that people want to be. They want to be at home, and they
Right,
want the
right.
care to take
Amongst
place
their
at home.
people who love them, even though sometimes they're too sick to know that there's people around, but they feel it. You know,
Yeah,
I believe they feel it, you know.
absolutely.
So,
Perfect. Well, that's a great way to end, Barb. Thank you so much for taking the time. It was so great to have you on and to share your wisdom and expertise. So thank you very much.
yeah, it was my pleasure. And I look forward to working with you in the future if anything comes up.
Sounds great. Thank you very much. Have a great rest of the day.
Okay, thanks. You too.
If you found this conversation valuable, please leave a review on your favorite podcast platform. Also, be sure to like, comment, and subscribe to our YouTube channel, The Business of Senior Care. We'll see you next time on Home Care. Doors open.